8 tips to prevent cancer. Things have been stressful at work lately. You're working long hours and your boss is really getting on your nerves. So, you numb the pain by binging on junk food, smoking cigarettes, and drinking alcohol. But instead of feeling better, you've only caused more problems for yourself. Now, your stressful job is the least of your concerns. By neglecting your health for so long, you're now at risk of developing several types of cancers. Hello, and welcome to MedTouch, the best place to find the right medical information. I'm sure you've heard of many conflicting reports about cancer prevention. Often, a study will recommend one specific cancer prevention tip, whilst another study will advise against it. The issue is that cancer prevention is still evolving, and we still don't know all the answers just yet. However, you might be glad to know that while it's not possible to completely prevent every single form of cancer, there are many effective, evidence-based ways you can significantly decrease your risk by simply changing what you do or don't do in your everyday life. So, if you're interested in taking control of your health and giving cancer the middle finger, make sure you keep watching. In today's video, we're sharing 8 tips that you can use to prevent cancer and live a healthier life. Tip 1. Stop smoking. If you're searching for the best way to prevent cancer, then it's time to throw away those cigarettes. Smoking is not only really bad for your health, but it's also linked to over 15 types of cancer. Yep, you heard correctly, 15. Cigarettes contain thousands and thousands of harmful chemicals. When you inhale these chemicals, they enter your lungs and get into your bloodstream, where they begin to interrupt the development of normal cell production. This causes your cells to multiply too quickly or grow abnormally, which results in the production of cancerous cells. And, if that's not bad enough, the secondhand smoke from your cigarettes can actually cause cancer in other people too. Just think, every time you smoke, you put yourself and everyone else around you at risk. Think about innocent children, elderly people, or those with weak immune systems who are harmed by your bad habit. So next time you go to light one up, ask yourself, is smoking really worth the risk? Sure, the decision to quit smoking can seem daunting, but it's important to keep in mind just how many benefits there are. Not only will you significantly decrease your chances of developing several types of cancers, but you'll also greatly reduce your risk of dying prematurely. And guess what? You won't have to wait long to feel the difference. Research has shown that just hours after throwing away your last cigarette, your body starts to repair itself. So what are you waiting for? There's never been a better time to quit. Here are some tips to get you started. Download a quit smoking app on your phone to help you stay on top of your goals. Avoid events or places where you know you'll be tempted to smoke. Try nicotine replacement therapy to help reduce your cravings. And seek advice from your doctor if you need extra assistance. There are also many free 24-hour hotlines that you can call to access information and support whenever you need it. Do a quick internet search to see what services are available in your area. And most importantly, don't give up. Tip 2. Stop drinking alcohol. So you've had a long, hard day at work and those cold beers in the fridge are practically calling out your name. But before you get too carried away, you might want to listen to this. For every drop of alcohol you consume, you increase your risk of developing several types of cancers, including liver cancer, breast cancer, mouth cancer, esophageal cancer, colorectal cancer, prostate cancer, and pancreatic cancer. I bet those beers don't seem too tempting now, do they? Like smoking, alcohol is a human carcinogen, which means that it has the capacity to change DNA in your cells, which results in the development of cancer. When your body metabolizes alcohol, it produces a highly toxic chemical known as acetaldehyde. Acetaldehyde damages cells and proteins in your body that play a role in preventing cancer. Drinking alcohol can also increase the amount of estrogen in your body, which can result in the development of breast cancer. In addition, alcohol can damage the lining of your mouth and throat, resulting in cancer of the mouth, lip, and esophagus. So, to prevent your risk of developing several types of cancer, cut alcohol out of your diet for good. Instead of reaching for a beer every night, try quenching your thirst with water instead. Not only will you be preventing several types of cancers, but you will also gain the added benefits associated with increasing your water intake. Water has many, many benefits for your body. It can aid digestion, give you glowing skin, normalize your blood pressure levels, and help you lose weight. And water doesn't have to be boring or tasteless either. If you like carbonated drinks, try drinking sparkling or mineral water, or perhaps try adding fruit or mint for some added flavor. Tip 3. Eat a healthy diet. I'm sure you're well aware that junk food is bad for your health. However, do you know just how bad it really is? Not only does regularly eating junk food increase your risk of weight gain, obesity, diabetes, and cardiovascular disease, but it can also significantly increase your risk of developing several cancers, such as bowel cancer, liver cancer, stomach cancer, and lung cancer. So, as it follows, one of the most important steps for preventing cancer is to eat a healthy, balanced diet, rich in fiber, whole grains, lean protein, fresh fruits and vegetables, and healthy fats. A great way to start improving your diet is to download a food diary app on your phone. Keep a record of everything that you eat during the week, and then, at the end of the week, review your entries to assess which foods you should be eating more or less of. Keep in mind that you should aim to eat at least 2 servings of fruit and at least 5 servings of vegetables each day. This may seem like a difficult task, but there are many ways you can add more healthy foods to your meals. For example, instead of ordering fries with your meal, order a salad instead. Or instead of having a coffee with your breakfast, make yourself a fruit smoothie. Try to avoid consuming processed and fatty red meats, foods low in fiber, artificially sweetened foods, deep fried foods, and very salty or pickled foods. And when cooking, try to avoid charring or burning your food, as this can produce a cancer-causing substance known as polycyclic aromatic hydrocarbon. Instead, try to use low-temperature methods as much as possible, such as steaming, boiling, baking, and stewing. Remember, it's okay to enjoy a treat every now and then. However, eating too many foods that are high in saturated fat, sugar, and salt may increase your risk of developing cancer. And although these foods may taste good, they're not a necessary part of any diet. Tip 4. Exercise regularly. Exercise has many benefits for your body, one of these being that it can help to prevent several types of cancer. As research shows, physical activity can prevent breast cancer by lowering estrogen levels in your body. It can also lower blood pressure, boost your immune system, reduce inflammation, and help to regulate your digestive system, which helps to prevent cancers of the bowel and colon. Exercise can also prevent several types of cancers associated with obesity. So, how much exercise should you do to prevent the risk of cancer? Well, as a general rule, try to engage in at least 30 minutes of medium intensity physical activity each day. Now, let's be honest, it can be pretty tempting to come up with any excuse not to exercise. This is because most of us are too scared or intimidated to try. To help increase your confidence, start out with small, achievable goals that you can gradually build upon. For instance, make your first goal to get up from your seat and walk for 30 seconds. Then, make your next goal to get up and walk for 5 minutes, then 10, and so on. It may seem silly at first, but you'll find it much less intimidating to start with really small, achievable goals. And just remember, exercise isn't a punishment. The key is to find an activity that you genuinely enjoy. And better yet, invite a friend to join you to help keep you motivated. By staying active, you'll not only boost your overall health, but you'll also be fighting off several types of cancer. Tip 5. Maintain a healthy weight. Let's be real. When life starts to take over, often our weight is the first thing we neglect. However, the more weight we gain, the higher our chance of developing several types of cancers. In fact, obesity has been linked to 13 different types of cancers. For example, research has shown that fat tissue produces excess levels of estrogen, which can significantly increase the risk of ovarian, breast, and endometrial cancers. Obesity can also result in elevated blood levels of insulin and insulin-like growth factor 1, which can promote colon, kidney, and prostate cancers. So, is your weight putting you at risk? A good way to check is to calculate your body mass index, your BMI. You can use an online BMI calculator, or you can download an app on your phone to calculate it for you. Generally, if your BMI is 25 or over, you'll have a higher than normal risk of developing cancer. So, to reduce your risk, you need to achieve and maintain a healthy body weight. Start by reducing your portion sizes and adding more fruits, vegetables, and whole grains to your diet. Cut out junk food and swap out your sugary drinks for water. In addition, engage in vigorous physical activity at least once a day. It's important to remember that everyone's needs are different, so consult with your doctor to see what weight loss plan will work best for you. Tip 6. Avoid sun exposure. It may seem harmless to spend a couple of hours outside getting a tan, but unfortunately, there's nothing harmless about UV radiation. UV radiation can penetrate the layers of your skin and cause significant cell damage, resulting in the development of several types of skin cancer. Luckily, skin cancer can be prevented by avoiding the sun and protecting your skin. Here are a few tips you can use. Avoid going outside during peak sun exposure hours. These are typically between 10 a.m. to 4 p.m. when the sun is at its hottest. When spending time outdoors, stay under cover as much as possible and always wear a hat, sunglasses, protective clothing, and sunscreen. And stay clear of tanning beds and solariums. These are just as harmful as spending time in the sun. If you'd like to learn more helpful tips, we have a video dedicated to preventing skin cancer on our channel. Click here to find out more. Tip 7. Get regular health checkups. One of the best ways to prevent cancer is to get regular cancer screenings. Your doctor will be able to perform different screening tests, which are extremely important for early detection of certain cancers. These types of tests may include skin checks for skin cancer, pap smears for cervical cancer, mammograms for breast cancer, or stool tests for bowel cancer. Be aware of different screening guidelines so you can determine which is most suitable based on your age and individual circumstances. It's also a good idea to become familiar with your body and to regularly check for any abnormalities or unusual changes. Some potential warning signs may include lumps or sores that bleed or don't heal, unexplained weight loss, changes in your bowel movements, blood in stool or urine, moles that change shape, size, or color, and persistent hoarse coughs that produce blood. As a general rule, visit your doctor as soon as you notice any unusual changes. Early detection of cancer can greatly improve your chances of treatment and survival. Tip 8. Start early screening if you have a family history of cancer. If you have a genetic predisposition to certain cancers, it's important that you follow early screening guidelines. For example, people who have a family history of breast cancer or bowel cancer need to start getting mammograms and endoscopies at an earlier age compared to the general population. Another example is people with familial dysplastic nevus syndrome. These people tend to have more abnormal-looking moles, which puts them at a greater risk of developing melanoma compared to the general population. As such, skin cancer checks need to start at very early ages and then again in short monthly intervals. So, if you have a family history of cancer, it's crucial that you follow guidelines regarding early screening tests and don't delay. When it's time to get screened, get it done as soon as possible. And remember, screening and early detection saves lives. So, there you have it, 8 tips to prevent cancer. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.